Hi, coming to you again from AlterG headquarters, where we change the way the world rehabs. What I want to talk about today is ACL rehab, specifically phase 1, so the early stages of ACL rehab. What we notice in ACL protocols is people are looking at clinical benchmarks. That's going to help determine when people can move on to the next phase. Yes, there's a timeline that you have to respect as far as the graft healing, but you also want to make sure people achieve certain goals before progressing them to the next phase. So what you want to do is make sure they get good knee extension in phase 1. You want to make sure they get good quad tone, and they need the knee extension to do that. And then you want to normalize that gait pattern as soon as you can. If people have problems that extend into longer periods of time, it's going to slow down the recovery. So you don't want any compensatory issues. You don't want that limping. You don't want people to have limited range of motion for too long. You want to minimize swelling, and you want to protect the healing graft. So the goal is to get people's motion back so that you don't cause excessive joint stiffness. They don't have problems with arthrofibrosis. They can continue along that timeline. They can progress from phase to phase. There's been an evolution in rehab where we've moved again from rest and mobilizing for someone for long periods of time to mobilizing them, moving them. So ACL protocols previously, you would have people in immobilizers for probably an extended period of time to allow that graft to heal. When they got out of the immobilizer, then you had a lot of scar tissue that people had to break out of. Nowadays, you see some patients come in even without a brace. I've had patients that come to the clinic. The surgeon doesn't recommend them use a brace because they want to restrict their range of motion. Now, of course, that depends on the type of surgery, the type of graft, possibly the surgeon's preference. Everybody's different, but we do get some which don't come in with bracing at all. CPM machines are encouraged for use at home so that you can encourage the mobility. You do not have the risk of arthrofibrosis if that joint is moving. And then you have accelerated protocols where people are being more aggressive with range of motion, where you're trying to push them into knee flexion sooner. You definitely want to focus on extension first, but they're not afraid to stress flexion a little bit so there's less stiffness. All of these things are focusing on the goal of movement. And if someone moves better, they're going to feel better, and ultimately they'll perform better. The consequences of immobilization, and the reason people are moving away from it, is you don't want joint stiffness. If someone's stiff in their joint, especially that patellofemoral joint, you got to mobilize that joint a lot more. They get the risk of getting scarring, arthrofibrosis in the tibiofemoral joint. Then if they don't get that knee flexion, you risk going back, getting a manipulation, maybe having even another surgery to remove scar tissue. So you want to move someone sooner. It also helps with their flexibility. They don't have to worry about losing that if they're an athlete. They don't worry so much about losing muscle tone. Atrophy sets in right after surgery because of inflammation, so you don't want to prolong that. You definitely want to get them stronger sooner. And then decreased proprioception. If someone's not loading their lower extremity, then they lose their balance. And you get the decreased proprioception in other joints as well. So if it's a knee surgery, you're not putting weight on that extremity, you're going to lose proprioception in the ankle and the hip also. So early controlled mobility is the key to rehab protocols now. And especially in ACL rehabs, you want to minimize those complications. If you minimize complication, you can get people back to activity sooner. So you want to restore that range of motion, you want to restore function, you want to get them moving sooner. People are walking on crutches without limitation usually. The only limitation is their quad. If the quad feels better, they can put more weight on that lower extremity and they can get back their movement. If they're moving sooner, you get improved clinical outcomes. And that's really, really important. You look at athletes nowadays, people are getting back on the field sooner and sooner. ACLs used to be the kiss of death, right? People would not get back to sports. They couldn't return to prior level of function. Now we see people return from 1, 2, 3 ACL surgeries to sport competition. So if we look at phase 1 rehab goals, one of the things we want to do is get people to full knee extension. If they're in a lot of pain, a lot of swelling, they're going to compensate, they're going to guard. So first thing is we want to eliminate that pain, encourage them to get full knee extension. Another goal is we want to protect the knee as it's healing so they don't keep swelling. If you have continued swelling, it's going to eliminate the progress that they might get in range of motion. They're going to feel stiffer in that joint. They're not going to want to bend it. They're not going to want to straighten it. So you want to minimize that swelling. Flexion is not as much of a concern in phase 1. You still want to work on it, but you don't want to force it. If you force it and get more swelling, you're going to go backwards in your rehab. So focus on that knee extension, focus on minimizing pain, and get what knee flexion you can. The goal is to minimize all the swelling so they can get good quad function. If they have swelling and pain, that leads to inhibition. So we want to get rid of that to allow them to work on their VMO. If they get a good quad contraction, then they can move to standing. They can move to weight bearing. And you want to normalize gait by 3 or 4 weeks so they remove any compensation in their hip or lumbar spine. You can get them off crutches, you can start loading them. In an anti-gravity treadmill, you can do all of these things sooner in phase 1. You can encourage them to get their range of motion back. We'll talk about how to do this a little bit in our demo room. You want to work on close kinetic strength sooner so you can avoid the muscle atrophy, get them back to proprioception. And lastly, you want to normalize that gait. So let's take a trip to the demo room and let me show you how you do this.